Alright, so Mr. Jones, 69, came in with some general fatigue, shortness of breath, and abdominal pain. He has a previous history of hypertension and coronary artery disease. He has a 90% LAD blockage and a 50% RCA blockage, but he does have placed stents for both. We did an initial assessment on Mr. Jones. We did some vital signs and found that his pulse, respirations, and blood pressure were elevated. His temperature was a little bit elevated. His blood pressure is 150/72. Heart rate was in between 102 to 123. And then his respirations also varied between 24 and 32. His temperature was 99.1 when he came in. So they did a chest x-ray, EKG, echocardiogram. They checked troponin levels, CBC, and did some kidney function tests just to make sure everything was okay. His urine output for, I believe, 3 hours. Let me see. Was 20 milliliters, so it was pretty low. And then since admission, so yeah, a couple hours. And then he has gained 3 kilograms of weight in the last 3 days, but he is filling up with some fluid because of this. He has some pulmonary edema. He has crackles in his lungs bilaterally and AMP. So some medication that he is on is digoxin and furosemide to try to help with that heart failure and some of that edema and pull off some. He has been complaining of abdomen pain. He rated it a 7 out of 10. It's a dull aching pain. It's not going anywhere. He said if he changes position, sometimes that helps. But he did have JVD present. His bowel sounds were present. He said about 4 days ago was his last bowel movement, but he was not too distended. His respirations are very labored and irregular. He's complaining a lot of a shortness of breath. And again, I said his lung sounds were crackling. He does have some periods of cool, clammy skin when we put his telemetry monitor on, but I have not noticed any more of that since. But he is alert and oriented. He can move himself, but he does have some edema in his ankles. Nothing in his wrist or anything I noticed, mainly in his feet. But he doesn't have any open areas or anything like that. So the last I checked on him, he was in with family and just hanging out.